Going live.
Hello, everybody, and welcome. Secretary Sutter is not here today, so I will be chairing the meeting as best I can. I'm Mike Chernow, and this is the May Connector Board meeting. I think we're going to start by reviewing the minutes. So before I ask for a vote to approve them, are there any comments on the minutes? Hearing none, do I have a motion to approve?
So moved. Second.
Thank you. Kathy, I think we have to do a roll call vote. Is that right?
That is correct.
So
Good morning, everyone.
Someone run
Rebecca, want to start now?
Yeah, no one has any comments. I'm ready to go through the vote.
Okay, Rebecca.
Aye.
Michael.
Aye.
Bayruth.
Yes.
Mark.
Yes.
John.
Yes.
Lauren.
Yes.
Nancy.
Yes.
Matt.
Yes.
Rena.
Yes.
I see Zarani.
Yes.
And I don't know, but Dimitri. Okay. So that's everybody.
All right. So the minutes are approved, and I think we can move on to the next agenda item, which is the Executive Director's Report. So I'm going to turn it over to you, Louis.
Good morning, all. We have a relatively brief agenda today, 2 agenda topics, inclusive of 1 vote. But the 2 topics are really central topics of the connector right now. They're the key things that we have been working on. The first one being, this is the first time we've had the opportunity for a public briefing in our full board context of the connector's work under the American Rescue Plan. The point of peculiar pride for me that we became the first state in the country, beating even the federal exchange, to make the American Rescue Plan subsidies available to our membership on the night of March the 26th. We're thrilled about that. And I'll let Audrey, I will not steal all the thunder, so Audrey will take us through where we are with the American Rescue Plan. By today, we shall have finished re-adjudicating all of our membership that had previously applied for financial subsidies to the new American Rescue Plan subsidies. The second topic, of course, is customer service. We have been working this topic especially hard. It's been a charter element of the direction we've had from the board for the 5 years I've been here now, with special work needing to take place since last summer's replacement of our existing service vendor. And so Michael and Vicki and Carrie will take us through current focus areas in customer service. I do want to indicate that we are exploring every single option to ensure that we get to a better place from a customer service perspective. We do not countenance or tolerate poor customer service as a practice at the connector. So with that having been said, I think I'm done with the executive director report. Michael, if you'd like to take us away.
Perfect. So Audrey, are you going to go through the American Rescue Plan update?
That's my plan. Thank you. Good morning. It's great to see everybody. Thanks so much for joining. As Louis noted, today's presentation is intended to provide an overview for the board on the Health Connector's progress implementing the health coverage provisions of the American Rescue Plan, which was signed into law by President Biden about 2 months ago on March 11th. We're pleased to share that we've been able to advance these changes quickly in order to get the new help lowering premiums out to existing members and members of the public, making Massachusetts the first state in the country to hook up to the new IRS calculator, generating expanded premium subsidies made possible through the ARP. We've completed the majority of the systems updates required to make these new benefits available, with lower premiums already in effect for the majority of our existing members. Now staff energies are chiefly focused on expanding awareness to all the residents not yet enrolled with a health connector who can newly benefit. Before we dive into the implementation updates, I'll provide a brief high-level refresher on the health coverage related provisions of the American Rescue Plan. For 2021 and 2022, the law makes premium tax credits more generous to individuals under 400% of the federal poverty level. That's an individual earning about $51,000 a year. And then the law newly allows many individuals over 400% of federal poverty to newly qualify for premium tax credit. This helps ensure that no one has to pay more than 8.5% of their household income towards coverage. And two other changes that have shorter effectiveness windows. For 2021 only, individuals receiving unemployment income can qualify for a $0 coverage option through exchanges like the Health Connector. And only through September 30th, individuals receiving COBRA who are involuntarily terminated from their employment can receive 100% federal subsidization of their COBRA coverage.
Audrey?
Yes.
Sorry. Just going back, if I understand correctly, those first two bullet points are permanent changes to the way we're going to operate as opposed to things going on through the public health emergency.
The first two changes with the premium tax credits being expanded are in place for 2021 and 2022. The president has proposed making them permanent, so that question is before Congress now and is open, but the changes for 2021 and 22 aren't linked specifically to the federal public health emergency.
I understand. They're temporary. I understand now. They're temporary. There's discussion of making them permanent, but it's not about the public health emergency.
That's correct. Yes. Thank you. Good clarification.
Audrey, just to that point, as you go through these, where there, could you distinguish where it's relevant between what's permanent, what's not, if that comes up anywhere else?
Sure, absolutely. Yes, none of these changes are permanent. They have varying lengths, but none of the premium tax credit changes are as of yet permanent, nor is the UI benefit or the COBRA change.
Okay, so I think that will just help us understand what some of the transitions and disjunctures and politics things we need.
And planning for their sunsetting, which is obviously we should be happy to have them before we plan for their sunsetting, but it's good to keep in mind.
Absolutely.
Yeah, I do think it's important to note that as of now, the unemployment insurance benefit is good only for plan year 2021, whereas the tax credits are for the 2 years. And as Audrey said, the COBRA subsidy is what, only through September?
September 30th. That's right.
Okay.
Yes. Okay. So to give you a sense of where we are with respect to implementation, for phase one, the Health Connector successfully hooked up its system to the new IRS calculator that was able to issue more generous tax credit amounts to individuals under 400% of federal poverty on March 26th, 15 days after the law was signed. Over the next several weeks, we proceeded to automatically rerun the eligibility of all of our under 400% of federal poverty level population in order to effectuate the increased subsidies and lower premium payments as quickly as possible. This was completed during April, resulting in lower premiums for members on their premiums for May coverage. Phase two is slated for completion today, which is the system update that allows us to rerun eligibility for our over 400% FPL population. This means that our previously unsubsidized members may now newly qualify for and receive premium tax credits to lower their premiums for June coverage and forward. This also means anyone newly applying for coverage through the Health Connector, regardless of income, can check for subsidy eligibility as well. Finally, phase three is implementation of the ARP benefit for individuals receiving unemployment income during 2021. And as Lewis just reminded us, that's a benefit that's only in place for 2021. We are tracking towards implementation of this benefit for July coverage, which is consistent with the timeline the federal marketplace is operating along as well. Next, we'll move to share what these changes we've effectuated so far have meant for our members. Between April and May, as we were implementing the expanded tax credits for our under 400% of federal poverty population, our members experienced an average of 31% reductions in their contributions towards premiums, saving individual members an average of about $25 per month. In the table here, you can see how significant the ranges of savings were, with a range of 7% up to 55% savings, with savings varying based on income and program type, and also because state premium wrap via connector care had been defraying much of the premium differential between pre and post ARP costs. To that point, the expansion of these federal premium tax credits are resulting in a reduction of about $81 million net of FFP per year in state premium wrap spending.
Audrey, is that chart showing the saving if you pick the least expensive plan?
It's showing what actual people are enrolled in. So some of our other examples in the deck show illustrative examples of if you pick the lowest cost plan, but this is actually what people are paying.
Okay, so it's average. So it's averaging.
Exactly.
Okay, thanks.
Sure. Okay. Although the prior slide's numbers paint a powerful picture of the impact of the new ARP subsidies, we also thought it would be important to share how members are responding to these changes. In a quick snapshot poll of members, 68% reported that the new changes to their premiums as a result of the American Rescue Plan were very or extremely helpful. And further, some members were willing to share in their own words what these changes have meant in their lives. We've shared a few such examples here, and as you can see, they reveal how even small reductions in premiums can be a source of palpable relief for people facing financial pressures, and in some cases allow people a broader range of life choices, whether it's being in a stronger position to afford groceries or making a career change.
I do want to add, excuse me, that this is one of the more powerful slides that I've seen in the course of my directorship. It's a reminder of how saving $10 a month can make a difference to a family. You know, these are very powerful statements of what it means to have health coverage and what it means to have even modest savings in that coverage.
Great. Okay. Having touched on what's already changed and what it's meant for those experiencing the changes, next we'll turn to where we plan to go from here. One of the biggest challenges ahead for the Health Connector in the weeks and months to come is making sure that people newly eligible for these expanded subsidies are made aware of it and can take action to enroll and take advantage of all these new federal dollars available for lowering their health coverage costs. These examples paint a picture of some of the kinds of savings that moderate income residents who may not realize there are new savings on the table, but can make a big difference for them. To help people figure out if they will qualify for these new savings and how much they would qualify for, the Health Connector has been working to stand up an online calculator that people can input a few pieces of basic information into to find out. This will remove the burden for people of having to complete a full application requesting financial assistance, which can take over 45 minutes, to find out if they're likely to qualify before going ahead and making out an application. We're slated to have this calculator launched and available on our website on May 23rd.
Audrey, a
Yeah.
quick question. This is Matt. So is that calculator something that the staff have devised, or is this something that is contemplated by either federal law or regulation? Just trying to get a sense of this sounds like innovation on the connector's part. Is that right?
Yeah, that is correct. We kind of came up with the idea as a need, just knowing that a lot of people might not want to go ahead with filling out a full application and then find out maybe they don't qualify or it's not a sufficient enough of money for them. So we've been working with a vendor to stand it up. So that was sort of on our own volition.
That's really great work.
Oh, thank you.
Thank you, Matt.
Pass that on to the team. Much appreciated. As we noted at the beginning, another key implementation step ahead of us as we look forward to rolling out to residents is the benefit created by the American Rescue Plan that will allow people who've received unemployment income to have access to a $0 coverage option this year. We'll be rolling out this benefit in the coming weeks and will communicate it to different kinds of constituencies about the steps they'll need to obtain it. This will happen automatically for people who are already enrolled in Health Connector coverage who've indicated on their application that they're already on UI, but will require different outreach to individuals who are on UI but not enrolled with the Health Connector. We're grateful for our partners at the Department of Unemployment Assistance who've agreed to help us get the word out to people on UI, and will continue to keep the board and the public apprised as this new benefit launches. As we approach our work to draw additional people into the ranks of the insured using the new help made available through the ARP, we're applying an equity framework and focusing on specific populations that face increased structural barriers to coverage or increased affordability challenges. With respect to our ongoing commitment to applying a racial equity framework to our work as an exchange, we've looked to understand the specific coverage gaps by race and ethnic groups in Massachusetts and what estimates of uninsured people or those who can newly benefit from ARP looks like. We continue to see coverage rates of Black, Hispanic, and Asian populations in Massachusetts lagging behind white residents. This is true across the country as well. And we've used census and other data sources to translate those coverage gaps into specific estimates of uninsured people in each population, as well as insured people newly eligible for help affording their coverage. As we move into our full outreach and awareness raising modes around ARP in the coming weeks and months, it's our goal to raise up these inequities and call out how the new affordability supports in the American Rescue Plan can help close these gaps and make sure that the healthcare access and financial protections that come with health coverage are fully realized by all residents and populations of the Commonwealth. We have specific media strategies identified with our media vendor, ASG, to intentionally reach these groups and are developing specific fact sheets and strategies for employing the help of stakeholders and opinion leaders that can help us most effectively carry the message about new savings and enrolling in coverage to communities of color. Another, yeah.
At some point, could we have a presentation on what we've learned working with Archipelago? What works? So what, we're in the, I don't know, 4th year maybe of working with them. This kind of micro community strategy, I think there's more and more evidence that particularly if you get to the rate of uninsurance that we're at, that it's very important.
Yes.
But I think we haven't heard anything in quite a while about what are we learning, how's that informing, how we're changing, what we're doing more of. And I think, now that we're not in the kind of hold the line, but we're in a different environment, I think, the federal government's certainly much more supportive in every way of trying to continue to make progress. So it just would be nice to hear what we've learned and how that should affect what we do in this new environment going forward.
Absolutely.
We would love to do that, and it's worthy of a full presentation because there's just a lot of detail underneath.
I think, for example, we've known since the first tax data that most people who aren't covered are eligible for free insurance, or any of them. We've known that it's disproportionately young people. We've known it's disproportionately Latinx men. We've known that there's some number who are non-citizens. So I think just kind of taking a step back, and we also know we've been at 3% since, for a very long time. And on the one hand, that's fantastic. And on the other hand, is that where we're just going to be and we have to say all these efforts are necessary to keep it there, or have we learned things which in a new environment and with more federal support we really could push to a new level? I guess that's the question I'm asking.
Okay.
Audrey, perhaps the insertion of one piece of good news at this point, which is the element of legislation that we in the governor's budget proposed to allow people to opt in on their tax returns to obtaining material from the connector is now in both the House and Senate budgets.
Before Audrey answers that, this whole thing has been good news. It's not just one piece.
Okay.
We concur, but thank you, Nancy. I think it's a great suggestion. And we have started to do some internal work, kind of quantifying outreach strategies and their impact. But I think we could broaden that and turn that into a fuller discussion, and agree. There's the outreach piece and the micro targeting strategy, but then I think there's also, how do we make on-ramps to coverage easier for people and less abrasive? And I think our hope is that the language that's pending right now could really help us take a big step forward.
Yeah, great. It just seems like a great juncture and
Agree.
happier era from this standpoint to kind of maybe renew our kind of consideration and our learning about that.
Absolutely. Thank you, Nancy. Will do. Okay, so another population that we intend to focus specifically on in our ARP outreach work is the older population that gets their coverage in the non-group market. Because of age rating in the commercial market, older individuals who are pre-Medicare eligibility are charged twice what younger residents are, and often face significant challenges affording coverage and point of service costs. Because the new ARP subsidies for people over 400% of the federal poverty level are tied to the specific premium someone themselves is charged, and because older people are charged more, they also stand to benefit more from the new subsidies. In these examples, you can see how meaningful the new subsidies that limit premiums to be no more than 8.5% of income are for these specific individuals, particularly in higher cost areas of the Commonwealth. We intend to place a special focus on outreach and information to this age group through targeted digital marketing and work with stakeholder groups that work with older adults. As we've noted, our work to optimize the immense new benefits and hundreds of millions of new federal dollars on the table for Massachusetts residents will require awareness raising and making sure people who don't get covered through us right now, whether it's because they're uninsured or buying individual coverage on their own elsewhere, are made aware of these new benefits. We've been working closely with our carrier partners to help raise awareness about the new ARP benefits, and also to remove barriers to entry for people looking to move from off-exchange non-group coverage to on-exchange non-group coverage in order to get these new subsidies. We're pleased to share that we have agreement from every single one of our carriers to honor accruals towards deductibles or maximum out-of-pocket limits for people who move from a carrier's off-exchange coverage to on-exchange coverage mid-year to come and obtain the new subsidies. We've also been working with our carrier partners for them to issue informational communications to the 61,000 people in off-exchange non-group coverage to make sure they know about the ARP and the new subsidies. We're also working with our carriers to have them contact people disenrolled from their commercial coverage over the last 12 months and have the majority of our carriers on board, with a couple more we are working to get over the line. We know from DOI special examination data that there was about 131,000 life drop in commercial coverage over the last year, and many of these individuals may be at higher risk of uninsurance or need help affording coverage now on account of a life change, a life circumstance change, or coverage disruption over the last year.
Audrey?
Yes.
One of the things that I think we reported on last meeting was the change in enrollment numbers because of the Medicaid churn, or the lack of Medicaid churn for that matter. This is an example where we conceivably could see a much larger enrollment increase as people move from the off-exchange market. My sense is, and I'm sorry, I apologize, it's been a while since I've looked at those charts that you usually give when I'm sitting there. As states go, we have a much smaller non-off-exchange market compared to others. But are we expecting a big influx of off-exchange people? And are there disruptions that we would worry about in the overall? Is that sort of universally a good thing to bring people on exchange, which I guess seems like it to me, since this is the connector board? Or are there concerns we would have when people who otherwise opted for off-exchange, they're giving something up to move on exchange?
Yeah.
I haven't completely got my head around all those issues. You may have some thoughts.
Yes. So you're right that compared to other states, the share of people buying their own coverage off exchange in the individual market is smaller. So there's a little bit, I guess, less of inroads to make there. It's our estimate that about a quarter of those people will newly qualify for subsidies, and so therefore ought to be, to save that money, to get those savings that are only available through the Health Connector. We also think there's people in the off-exchange market who may actually be under 400% of federal poverty and don't know that they already were qualifying for subsidies. So there's the subsidy question, just since we're the only game in town for access to those. But with the fact that we have all of the Massachusetts carriers participating on exchange, it gives people that peace of mind that if there's a particular reason that they're with a carrier, they have all these product options on exchange as well. And of course, they have the benefit of comparison shopping as well as the subsidies that they can only access through us. Our worry, candidly, at the beginning of this had been that for people who are partway through a plan year that have been contributing towards their deductible or their MOOP, that they wouldn't want to lose that, and so they would leave the subsidy money on the table just for the not having to deal with that loss. So that's why we were really pleased that the carriers all came to the table and said, if someone moves from our product off exchange to one of our products on exchange, we'll honor that and move that over for them. And of course, we are biased, and I guess feeling that certainly we're a great coverage destination and source for comparison shopping and access to the full market for people in the non-group market, particularly now that there's no income cap on subsidy eligibility.
So so first of all, I'm not sophisticated enough to have the main concern that you had, and the main concern that you had now would have been my main concern. But my main concern had been that we've been having some issues with customer service and staffing in the call centers and a whole other bunch of things. When you bring a bunch of new people that haven't been on the connector to the connector, it's possible they'll have a series of questions about how it works and put burden on a resource that already has been one that we've been very concerned about. So if you told me that we were, I know you're not going to say this, but if you told me we were doubling our size or doubling the number of new members, and we were expecting the call center volume to go up by 30%, I happen to know a little bit what we're going to talk about later today, and I would worry about how that process is going to go. So anyway, that's why I was asking.
Got it. That's helpful. And yes, the second presentation will speak to some of the steps we've taken just to make sure that, new volume of calls or new members with respect to or responsive to the American Rescue Plan have their needs met, and that we're ready for that volume. But good question. Okay. Any other questions before I press forward? Okay. We continue to conduct and plan for all manner of community outreach and communications using all the channels and relationships we have available to us to promote the new ARP opportunities, including communications to our existing and former members, communications to people on unemployment, a mailing that the Department of Revenue will mail on our behalf to over 100,000 people who indicated on their 2020 state taxes that they were uninsured for all or some of the year. Our team also developed and deepened ties over the last year of the pandemic with a lot of community-based groups and offices like food banks and others that work with populations we share mutual interest in serving and helping, and have been fortunate to be able to tap into their networks to help us get information out to the public. As part of our extensive forthcoming ARP communications, the Health Connector will also be amplifying the Commonwealth's ongoing COVID vaccine promotion campaign, Trust the Facts, Get the Vax, and already has a mailing slated to 300,000 of its own members with vaccine information in the coming weeks. We've been working to develop easy to digest and easy to share information for the public via our website and on social media. We continue to benefit greatly from a wide network of sister agencies, elected officials, navigators and assisters, healthcare providers, carriers, and others who share our information with their networks and are helping us publicize ARP and the tools we have to help people figure out how to enroll and get help, like online FAQs and our free monthly public webinars. For maximizing the new coverage savings through the ARP and casting as wide a net as possible to increase uptake of the new federal savings and enroll even more of the remaining uninsured, the Health Connector has developed a paid marketing strategy with our longtime partners at ASG, formerly known as Archipelago Strategies Group, that highlights the new benefits and frames them in an uplifting mood and tone consistent with the state's frame of mind moving out of the pandemic and things getting better. Staff recommend entering into a work order to support the paid marketing and public education activities described on some of the previous slides in here, which are designed to broaden awareness and promote enrollment in Health Connector coverage among the uninsured and those newly benefiting from federal savings made possible by the ARP. These activities will involve digital media, TV and radio, ethnic media placement consistent with our ongoing equity focus and goals, and other targeted community activities. Okay, and I will let the vice chair call for the vote, but here just noting that staff recommend that the board authorize a work order with ASG for a not to exceed amount of 1.7 million to perform paid outreach and communication activities described in this presentation.
Great. So the interim tentative chair, right? Thank you, Audrey. I have a question or two, but let's see if others have any comments they want to make before we call for the vote. I'm not sure I can see chats or hands, by the way, so just interrupt as I do. All right, so my question is, first of all, I want to commend you on the overall orientation. I was enthusiastic but uncertain about how the equity and population focused stuff was going to go since we've been talking about that. And I want to commend you overall that those weren't just empty words, that I think we've seen this in every board meeting, sort of concrete manifestations of that broad perspective. And I think that's generally a good thing. So not to like foreshadow, I'm going to end up being supportive of this. My enthusiastically, probably my issue is sort of in general in spending money. I'm not sure what the opportunity cost is or what, it strikes me that this is motivated for several reasons. One of which, just because of the ARP, we need to do more outreach because of that. Of course, there's just general outreach that we broadly need to do as we begin to think about our focus and who's doing what. So I just want to make sure that when we think through the budget and where we're going, that we're not, say, for example, getting into a situation where we have to compare priorities. For example, we're going to have a discussion about customer service. So it's easy. This is obviously a good thing. I'm very supportive of it. If you told me this money was coming out of the customer service budget, I would then have a different type of conversation. So I just am curious as to how you feel about what we're giving up or not if we spend this money, or if we have the money and it's just something that we should do because it's obviously a good thing to do.
Yeah, one comment I'd make in this regard is we have the approval of the A&F subcommittee, though Rena, please correct me if I'm incorrect in any detail, to look towards offsetting this amount from the $81 million in savings projected for the CCTF because of the ARP subsidies. So this plus implementation costs for the ARP total on the order of about 6.2 million. We're looking and hoping for about 1 million in federal grant opportunity. And so we're looking to offset roughly 5.2 million, of which this is part against the $81 million savings to the state RAP funding, and have received approval from Cassandra Roeder at Administration and Finance for that.
So now I understand. So if I understand part of the nuance, and maybe this is an oversimplification, but that works for me in person and even on the Zoom, is in some ways this is spending some of the ARP RAP offset.
Yes, yes.
So there's a question about what to do with that money. And I think as opposed to other things we might want to do, and if I understand the numbers you just said, there's even a little more above this of a RAP saving, so the state can keep some of it, and we might have some other opportunities where there's high value things to do. So now I understand. Did I get that? Maybe I may have said I understood.
No, you got that right. There remain, again, projections of about 76 million of remaining savings that will be for all to consider with regard to their.
Exactly. And just to be super clear, that's not all our money per se, that's the state money. And so there's a lot of priorities at the state level that one must to deal with. But it strikes me in general that this is a reasonable way to spend what seems to be like actually a small portion of a bigger number. So we should be grateful. I have no other questions. So there are other questions or comments before we vote?
Michael, could I add, in this particular moment, both in terms of the pandemic the suffering, the opportunity through these federal expansions. It's hard to me to imagine a moment in which this spending would be better to try to keep people insured and hopefully find some new people. So I look forward to making the motion once we finish our discussion.
There. Does anyone look forward to seconding it? Before we do that, let's see if there's any other comments.
Sure, Michael, this is Lauren. I just wanted to sort of channel the secretary in her absence. I think we should, with this additional outreach, we should leverage where appropriate, including given the populations. I think that many of the populations that we're targeting through these additional outreach and communication activities, we should be adding in messaging around vaccinations and making sure that people are aware of, how they can access vaccine and the importance of it. So I think there's a good opportunity and synergy here to leverage this additional outreach to help promote those efforts as well.
Great. Nancy, I think you're up. Time to make a motion.
I move.
Good.
Second.
Thank you. All right. Having a motion and a second for the vote. Kathy, can we go through the vote?
We sure can. All right. Rebecca,
Yes.
Michael,
Yes.
Hey, Ruth,
Yes.
Mark,
Yes.
John,
Yes.
Lauren,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
Zarani.
Yes.
Thank you, everyone.
Great. So the motion carries.
Actually,
Yeah, right. Exactly. Dimitri joined
Kathy,
us.
I think you left me out, but
Right, exactly.
Okay, sorry about that. Dimitri.
but it's yes.
Yeah.
Thank you. Sorry, I didn't see you.
Right. Because no one can see him, just his name, but he didn't. He missed the original roll call. Dimitri, welcome to the meeting. I know you joined shortly after we started. I'm sorry you weren't on my front page of folks that I see. So now we're going to transition to the issue I alluded to a moment ago, which is the customer experience update. I'm not sure who's taking us through that, but I'm turning it over to Michael or Vicky or
Hi.
Michael and Carrie.
Vicky, Michael, and Carrie. So,
Perfect. Go ahead.
yeah. Okay, thank you. Good morning. As Lewis indicated today, myself along with Carrie and Michael are
Did we just lose video or is that just me? I'm sorry, forgive me. Oh no, it's me. It was me. Forgive me.
okay. So we're going to provide an update, Carrie, Michael, and myself, regarding the stabilization activities with our contact center and enrollment premium billing vendors. Regarding the contact center, I'll touch on our two immediate priorities, which are regarding the American Rescue Plan implementation and service, and improving our agent assist desk, which handles escalated member cases. And Michael's going to provide an update on the EPV vendor, among other things, release and triage planning, and then Carrie's going to talk about controls. So I'll start. Michael, do you mind moving to the next slide, please? So we've been working closely with our contact center vendor to implement the American Rescue Plan since it passed and was implemented by the president. This included updating messages on our interactive voice response, where we created a special queue that if people are calling in and know they have questions about that, they can go directly to staff to answer that. We also conducted training for all staff in the call center on the American Rescue Plan, which included topics like why people are eligible, when they can expect to see a change. And then we identified a subset of staff who were hand-selected to receive further training on complex scenarios like COBRA and unemployment insurance. And they're the ones that staff the interactive voice response queue. And I'll talk about that in a second. We hired about 50 additional staff in order to staff that queue. We also created new workflows so that agents can use those to guide them to handle calls. And then we have worked on a forecast and staffing to expect an increase in call volume related to ARP and the open enrollment. I will say that for April, we were under forecast for calls, but we hear that that's true across all the exchanges with the extended open enrollments. And we expect that and anticipate still that that will increase with the additional marketing activities that Audrey just went over. Michael, do you mind moving to the next one? So this outlines for you this ARPQ on the interactive voice response. If a member self-selects at the beginning that they want to talk about American Rescue Plan, they get routed to an agent who can assist with that. And if they're unable to finish all the questions or have additional ones, they are routed to the agent assist desk, who are folks that have the most tenure in the call center and are specifically also trained on ARP. But we also anticipated that someone could come in on the general enrollment line, which is scenario 2. And then after they're in the call, it is determined that they have additional American Rescue Plan questions. So we've arranged for warm transfer. That's where if a member needs to speak to one of the people that are specially selected for American Rescue Plan queue, the first agent transfers to the second, but stays on the line until the second agent picks up. There's no gap. So that was put in place on April 20th, which allowed us to set up the queue, select the staff, train the full staff, and then put in place the 50 staff that are on the ARP line. Michael, could you move to next? So this slide shows, since we started the special queue, what's come in on that. We've had 3,500 calls as of last night that had come in through the special queue. Most of them are general FAQs, but you'll see the range of questions. The other thing that I would say that we have been doing this is each week we listen to these ARP specific calls with our staff and our contact centers QA staff to see if there's any additional training needs based on calls that come in and patterns. And based on these reviews, we've determined that we're going to have 2 micro trainings next week. One is where members inquire why they haven't seen a decrease in premiums, since many people might anticipate that. The most common scenario we've seen with that is, as we redetermined people for the American Rescue Plan, some people aged out into Medicare, which means they wouldn't have seen a decrease in their connector premiums. And then we do have people that, interesting enough, are concerned they're getting additional ATPC, and they're concerned about tax reconciliation at the end of the year. So the guidance there is, as long as your income is accurate, you are eligible for the subsidies, and you should plan on them, but you can always opt out of taking more APTC if you want. But those are the 2 micro trainings next week. Michael, do you mind moving to the next slide, Michael?
Yeah, we need to have fewer Michaels. That's the main takeaway from this presentation.
So he's known affectionately as Michael P. around the connector. So to differentiate from the other 2 Michaels we have.
Will you entertain a question from someone not named Michael?
Yes.
Are we getting many questions about provider networks and differences in connector care and coverage people might have previously had? Or is that just not?
It's not come up as a driver from the ARP calls. I mean, people do ask those things when they enroll, and we'd have careful scripts about make sure you look at the network, and but it's not. Michael, sorry, could you back up one, please? Really, it's mostly about these general FAQs and just some astonishment that my premium has changed. The May bills had the new premium on them. So you saw from Audrey's slides with the member quotes, many people, when they opened their bills for the May run, were astonished to see that things had changed and gone down.
Yeah, I'd be very curious as this proceeds, whether that becomes at all something that we hear about, particularly many people who've lost jobs may have had health plans that gave them a more extensive network of providers. And as they shift, in particular into connector care, that might end up being different. So yeah, I'm just curious about that.
Yep. Part of the reason that's why we pull the calls every week, because this is new to us. We took a our best guesses on forecast in addition to regular forecasts for ARP. And then we also want to make sure we know what the trend is that's coming in on the call. So
Great. It's just an area where some of our plans are quite different than what most people in the employer market at least have. So great.
Yeah, understood. Yep. Okay. So the last second, we have two top priorities with our contact center vendor. One is obviously our ARP and answering those calls and getting it right. The second major area of focus with them is the agent assist desk. If you remember, this is a unit that was put in place to decrease repeat calls, increase first call resolution across the call center, but also handle escalations in a manner similar to our ombudsman team. The current work with the call center is restructuring and retraining this unit and improving overall compliance with their operating processes. So that work is actively underway. All right, I'm going to turn it over to Michael. He'll talk about enrollment, premium, and billing. Thank you.
Thank you, Vicki, and good morning, everyone. The enrollment and premium billing system has been live for over 9 months now and has handled significant volume since our cutover back in July. The table displayed here reflects some highlighted transaction volumes by month. Since go live, the system has handled over 1.5 million enrollment transactions from the HICS, with significant spikes in November and December related to open enrollment renewals, and again in April in response to the American Rescue Plan Phase 1 changes that Audrey discussed earlier. Additionally, the system has processed over 2.4 million payments, totaling over $473 million. While a lot of activity moves through the system on a daily basis, we continue to make ongoing updates by deploying system releases to production. On May 25th, we're planning to deploy another release, which will deliver changes throughout the system, including areas affecting enrollment, payment, finance, communications, and the member portal. At the start of implementation, we established a warranty period for the delivery of enrollment and premium billing services, as well as the member portal. This period ran for 6 months from go live and closed on January 5th. Since that time, the Health Connector worked with the vendor to compile the full list of defects subject to warranty and finalize next steps for those issues. The release on May 25th is expected to deliver several items that are needed to close the warranty milestones. And these are the final milestones associated with implementation, carrying 20% of the overall implementation costs. In addition to system updates, we're working with the vendor on several process improvement initiatives. First, we're working to improve triage processes and turnaround times associated with new issues that are reported. We also established a 90-day goal to implement enhanced dashboards that monitor member-level transactions and notices for critical business processes, including the monthly bill run and the delinquency run. Work is underway to implement control improvements suggested by KPMG regarding member payments, and the Health Connector is engaging KPMG again to review additional processes in advance of a service organization controls, commonly referred to as a SOC audit. And unless there are questions, I'll now pass it to Carrie to provide more information regarding the progress on controls overall. Carrie?
Thank you, Michael, and good morning, members of the Health Connector Board. Thank you for the opportunity to share the progress that we've made with respect to our controls project, which is currently focused on our premium billing vendor. The purpose of this project is to assess the current internal control environment around certain key business processes. The goal here is to prevent issues and minimize risk to the Health Connector, our members, carrier partners, and other stakeholders. Since last fall, we have been focused on identifying and implementing preventative controls to ensure that these processes perform as expected. We've worked with the vendor to identify the processes, their associated tasks, and points during the process where independent validations can be performed to ensure that everything is working as expected. The areas of focus include, as you know, the member payments, refunds, carrier payments, delinquency, enrollment and effectuation, and federal reporting, among some others. For each of these processes, the goal here would be to implement control reports and develop the supporting documentation to ensure that everything can be verified. Control reports are very important in that they provide a view of overall system health, integrity, and compliance. They establish a baseline assessment for ongoing processes by comparing expected to actual results so that any discrepancies will be surfaced, they can be explained and remediated if necessary prior to either completing or proceeding with that business process. And these reports will be used on an ongoing basis by the process owners at both the Health Connector and Softheon to attest and concur that these processes have been validated. Our initial priority is the implementation of controls around high-risk areas. Obviously, we want these controls automated, and these will be subsequently addressed. We're pleased to report that today we have 3 functioning controls that have been implemented for the member payments, the delinquency, and the annual 1095A generation process. And we are currently working with the vendor on controls around the carrier payment process. So in addition to the preventative controls that I just discussed, we've also implemented detective controls and other financial integrity measures to act as guardrails on the system. You may have heard us refer to health checks in the past, which were designed and developed by my colleague and our chief architect, Elliot Gorman. We use these health checks and other financial validations to detect any issues after the fact as another way of mitigating risk around these processes. This is monitored monthly, and again, same with preventative controls. Any discrepancies that are surfaced because they are not in line with expectations are either explained or remediated. We will continue to keep the board apprised of our progress in this area, and I will pause for any questions.
That's the last slide. That's the last slide, by the way, if I understand, Carrie. So this is not the pause before the next set of slides. This is questions on the entire direction of where we're going. And these slides perhaps convey, I'm not sure they came across how much immense work has been done in this area to be captured in just 12 slides. It's obviously really important. So thank you to you, Carrie, and Vicki and Michael for all of your work. I have no questions. Other questions or comments? All right, so I'll give you, let's see how well I can do this, a general Zoom thumbs up. Louis, I don't see any other items on the connectors business for today. So that will lead me to ask for a motion to adjourn. Now I see you nodding. So I'm going to ask for a motion to adjourn.
So moved.
Second.
All right. So Kathy, I think it is time for your last roll call vote of the day.
Okay. Rebecca,
Yes.
Michael,
Yes.
Ruth,
Yes.
Mark,
Yes.
John,
Yes.
Dimitri,
Yes.
Lauren,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
Zarani.
Yes.
Thank you, everyone.
Wonderful. So with that, we are adjourned. I hope everyone has a safe and happy rest of the month till our next meeting. And again, thank you for the staff. I know there's no rest for the weary. Although the ARP is good for us in a whole range of ways, it is more work for you. And thank you for that. So
Thank you all.
everybody, I don't know if there's any other closing comments, but I'm signing off.
Thanks, Michael. Thanks, Louis.
Thank you.
Thank you.
Bye.
Bye.